All right, hello everyone, and welcome to the 6th and last session in our Safe Systems Summer Learning Series presented by the Collaborative Sciences Center for Road Safety, or CSCRS. My name is Kristen Brookshire. I'm a research associate at the UNC Highway Safety Research Center where CSCRS is housed. I'll give you all a quick orientation to this session in the series, and then I'll turn things over to our moderator, Kelly Evenson. So CSCRS was established in 2016 as one of the 5 National University Transportation Research Centers funded by the FAST Act. We are a consortium of research partners from 5 universities: UNC Chapel Hill, Duke University, Florida Atlantic University, UC Berkeley, and University of Tennessee, Knoxville, with many of our students and researchers participating in or helping to moderate this series. So if you're not yet familiar with CSCRS, our consortium recognizes that transportation challenges are increasingly complex and interconnected, and that this demands new skills and approaches to problem solving. We bring together expertise in engineering, planning, robotics and data science, public health, which will especially be on display today with our panel, and other fields to develop new ways to approach our most enduring and complex safety issues. So 2 years ago, our consortium held its first conference, the Safe Systems Summit, organized around systems-oriented approaches to address transportation safety challenges. We introduced concepts around safe systems and system science, which can be used to explore system assumptions and interactions. And in a summer learning series that you're here for today, we continue to host a space, this time virtually, to share ideas and questions around these concepts and to reflect upon the ways in which we as a research and practice community can both appreciate the complexity of the transportation system while continuing to foster shared goals and identify innovative new ways to address enduring safety issues. So we started off the series with a discussion about what we mean by the word safety and how that definition changes for different people in different times, places, or situations. And in the second session, we had panelists with very diverse academic backgrounds talking about why people make errors in our transportation system, and then debating how we might design, advocate, or regulate our way out of those errors. Issues with crash reporting, media narratives, and other socio-cultural factors came up in that session as well, and especially in our 5th session about how we assign responsibility for transportation safety. And topics throughout the other sessions included public engagement and how that engagement should be genuine and relationship-based and not transactional. And we've had discussions about policies that affect how policies about land use and mode choice relate to safety. So for today, before I kick things over to Kelly, I just want to remind everyone that this session is being recorded and it will be posted online. Today, you can use the chat box to introduce yourself. We welcome you to introduce yourself and where you're from, and share observations and questions and resources that are relevant for the group gathered today. We'll probably let the panelists go for a little while, and then maybe we can look for some questions throughout the second half of the session. I just want to point out the chat defaults to panelists only, so make sure and switch it to everyone so that other attendees have a chance to see and maybe respond to something that you've posted. And if you're tweeting today, you can use the hashtag that's along the bottom of the slide, CSCRS Learning. And now I will turn things over to our moderator, Kelly Evenson. She's a professor of epidemiology at UNC Chapel Hill in the Gillings School of Global Public Health. Her research focuses on physical activity and sedentary behavior with specific interests in measurement, surveillance, intervention, and associations with outcomes. Dr. Evenson also conducts research to identify and evaluate policies and environments that support physical activity and reduce sedentary behavior. Kelly?
Thanks, Kristen, for that overview and introduction. It's a pleasure to join you this afternoon to hear from 3 experts in the field. To start off our conversation, I will give a brief bio of each panelist in alphabetical order and ask them each to respond with opening comments around building capacity for positive change. First is Dr. Becky Nelman, a research assistant professor in the Department of Epidemiology at UNC Gillings School of Global Health. and core faculty at UNC's Injury Prevention Research Center. Her main area of research is injury prevention. Her work is focused on understanding risk factors and trends of unintentional injuries and evaluating injury prevention interventions, largely in the areas of road traffic injury and opioid overdose. Methodologically, Becky has experience and interest in applying complex systems science methods to injury prevention. So welcome, Becky. So I want to invite you to be the first to comment on the topic of building capacity within our communities and agencies for positive change, and particularly in the transportation system.
All right, thanks, Kelly. It's excited to be part of this group today and to really help close out this summer learning series. I know I've learned a lot. It's been a great kind of conversation series. So in terms of what we're talking about today related to building capacity within our communities, within our agencies, and how we really kind of bring about these big changes, right, that we've been talking about throughout this series. I think there's several things that probably need to happen, but the thing I kind of reflect on the most is really investing in kind of relationship development to achieve this larger systems change. And we've been talking a lot about what this kind of larger systems change is throughout, right? Rethinking our funding structures, what we invest in, how we work with our communities to lay a foundation for this work. And so I think, a lot of times, I know I do this a lot in my own job, right? We're so focused on the kind of technical day-to-day aspects of our jobs that it can be really hard to kind of make time and recognize the investment needed in creating those more effective communication and collaboration networks, in really understanding where all of our technical solutions kind of fit together, right, to actually change the system and change things in a bigger way. And make sure that what our partner is doing over here isn't undermining what we're trying to do or what another partner might be doing in a different space, right? And that's really common. We see that a lot in transportation, right? Is the built environment actually supporting the public health work of trying to get more people, biking and walking? Not all the time. So when I think about this capacity building work and this big picture kind of relationship building work that we need to be doing, I kind of think about it in three different buckets. So the first bucket is how we can better facilitate stronger relationships between the different agencies and organizations working in this space, be it planning, engineering, public health, social work, kind of, et cetera. And I think there's some exciting tools that we can talk about today that I know I find really helpful and I think have been helpful to some of the multidisciplinary coalitions that we work with to help kind of tangibly cement some of those relationships and better align kind of goals and objectives. The second bucket that we've heard a lot about in this series that is so important in terms of developing these stronger critical relationships to this big transportation system change is better investing in and building capacity to more authentically work with our communities, right? Those who kind of live and breathe these road safety problems that we see every day. And we've heard beautiful words from kind of Destiny Thomas, Tamika Butler, Adil Ortiz, several others who have talked in this series about really investing in communities from both a time and monetary perspective and listening to what's needed. So that's kind of the second bucket that I think deserves attention. And then the third bucket, and this is going to be my bias of sitting in a university setting, is kind of investment and more strategically thinking about the pipeline. And I think there's a lot of exciting movement in that space, right? As you see this kind of more and more degree programs popping up where you can get a dual degree in planning and public health or business, right? I get really excited when I see these because I think, oh, these people, these are going to be our bridges, right? These are going to be the people that can really talk all the languages or better relate between kind of critical stakeholders. But irrespective of those programs, I think we have a responsibility in our kind of universities and training systems to really kind of build up those skills and thinking about system change and thinking about collaboration more effectively so that those who are moving into the workforce are kind of already thinking that way. So I'll stop there and turn it back to you, Kelly.
Okay, thank you, Becky. That was very insightful. Dr. Stephen Orton is an adjunct assistant professor in health policy and management at UNC Gillings School of Global Public Health and a senior fellow in public health leadership at the North Carolina Institute for Public Health. He's an expert in helping organizations develop leaders and create organizational change in both public health and health care. Dr. Orton leads the Change Management Core for the National Maternal and Child Health Workforce Development Center. He facilitates strategic planning and teaches on leadership and management for local health organizations, focusing in North Carolina. He designs and directs a custom healthcare leadership program for a healthcare system in the state, and he co-leads the National Program Office of Kresge's Foundation's Emerging Leaders in Public Health program, a flagship leadership development grant directed at local public health officers. So we welcome Steve to the conversation and invite him to comment on the topic of building capacity within our communities and agencies for positive change.
Thanks, Kelly. It's a great question. I love this question. I mean, and yes, you should absolutely do that. I want to tell you a little bit about the Kresge funded work we're doing with local public health departments all across the country. The framing question that we're using in that program is to ask the leaders who come to us, what's your new role? What's your role in the system that you're trying to change? That question has been really, I think, really helpful for people to grapple with. They've grappled with it for some of them for a year before they actually start working, because it makes you think about, yeah, what is it? How am I going to try to show up in this system change? And it makes you think about what's the capacity that you want to discover or build in the community. But before that, what's the capacity you want to discover or build in yourself first, in your own agency or in yourself as a leader? So to me, that's a really key place to start if you're thinking about building capacity, is for what? How are we going to try to show up? Because that's going to drive a lot of the decisions you make about what to do to strengthen the muscles that need to be strengthened, or make the most of the muscles that you have, both of which are important capacity building components. I'm excited to talk to you guys because I know that you're designers. You're like, that's your thing. So you get a lot of design things that I feel like lots of folks in public health want and need to get better at. I mean, you understand that design loves constraint, and you understand that I need to know what I've got going in so that I can build the thing. And I guess what's exciting to me about the whole Vision Zero approach is it's making a really nice, big new frame around, yeah, zero is the goal. And we're going to do it a new way. We're going to be the equity people. We have a role in the system to increase equity in our community, to make sure that the things that we're building help create equity and health across our communities. That's pretty inspiring and pretty exciting. And I would say there are some really good tools to help you facilitate those relationships, Becky, to find people who also have that goal and have a perspective on where are we now, and a perspective on where do we most want to go. So a piece of the building capacity mindset, I think, is we're trying to build something that's not all the way there yet. We're in learning mindset. We're in growth mindset. We're not in, well, we're just executing on what somebody else said. We're starting from, there's actually a need for us to uncover perspectives across a lot of different stakeholders so that we can understand exactly what the goals and aspirations are across the community, and to figure out how are we going to meet those goals and aspirations as a collective. There's some really good tools around bringing people into that kind of a process that I've used a lot in my work in leadership development. When I do leadership development, we typically don't do it with solo leaders without a team involved or a whole agency, and without their real work being involved, because leadership is a team sport, and you've got to know, well, leading towards what? Leadership is, in my view, a function that's served when you're trying to move everybody in the group to a better place over time. So, so how do we do that? Well, you have to bring the whole group. You have to have the perspectives of the whole group, and you have to be really clear about where is it that we all want to go? Where's the overlap? I mean, these are design things, right? I think the other thing I would say about building capacity in yourselves and others is that you might not have to build all of it. Some of it's there. Maybe a lot of it is there. And my work's leadership development. And I often say to clients, which sometimes means communities, let's shine a spotlight. This program is going to shine a spotlight, and leaders are going to emerge. Some of them are there already. All we have to do is give them a platform and put a light on, and it's going to happen. There's a great book by John Gardner called On Leadership. It's from the 80s, but it's great. It's such a good book. He comes down, to me, I can summarize it in 3 words. Your job as a leader is to unleash human potential. There's human potential in our agencies that's untapped or that's tamped down. There's a ton of leadership potential in our communities that we just haven't found yet. We haven't looked in the right places. Sometimes we haven't shined the spotlight yet. So building capacity in some respect will just be finding capacity. That's probably true of ourselves as leaders too. It's finding capacity in ourselves that's there, but not yet, hasn't yet emerged. I think I'll stop there, Kelly.
Yeah, thank you for that positive perspective. And maybe we can circle back at some point and have you talk about how to find that capacity. So the third distinguished speaker is Dr. Keshia Pollock Porter, a professor in the Johns Hopkins Bloomberg School of Public Health, where she is director of the school's Institute for Health and Social Policy and part of the leadership team for the Hopkins Center for Health Disparities Solutions. She's an injury epidemiologist and policy researcher who uses mixed methods to examine active play and active transportation, safe built environments, and the nexus of transportation and health. Dr. Pollock Porter's current work includes a growing portfolio examining policies and practices that promote inclusive and anti-racist public spaces, and is a leading health equity scholar whose research and practices address the determinants of health. And we welcome Kisha to the conversation. And I want to invite you to comment on the topic around building capacity from your perspective, both within communities and agencies for positive change in our transportation system.
Great, thank you so much, Kelly, for that really kind introduction, and I'm excited to be here and in conversation with Becky and Steve, and look forward to more conversation with all of you who are participating in the Zoom link today, or the Zoom session today. What I want to say is in this conversation is, you know, I'm an epidemiologist turned policy person. I tell people that all the time. And part of my motivation for this space, when I think back to when I started this work, maybe nearly 20 years ago now, is I saw potential for science and evidence to inform policy. And I worked on staff for an elected official in Maryland. And I remember him saying to me, you know, we need people like you, me at the time, you know, being a researcher, to help bring evidence to the policy process, to help bring data and stories, because votes are going to happen with or without the evidence, so they might as well have it, right? And I remember that, so that statement, and it's really stuck with me. And so what I do now when I think about building capacity is I think about how do we support my fellow colleagues who are researchers in the academic space to engage in the policy process? How do we support community members? And I think that there's so many threads with the prior sessions that have talked about how do we promote active and authentic community engagement, and thinking about working and partnering with community when we go to engage in the policy process. I also think about the role for practitioners like yourselves who are on this call, for our transportation engineers and planners and other colleagues. And then as a faculty member, I'm an educator. So then I think about too, how do I educate students to be more confident in this space? And one of the things I tell all of those audiences is the policy process is accessible. It may not always feel that way, but it is accessible. And so the question is, how do we engage? How do we show up? How do we hold our policymakers accountable and have our voices heard in a system that's really not always meant for all of us to be part of? And so when I think about this engagement part for positive change around safe systems, to me, policy has to be part of the conversation. You know, when we're talking about changing the built environment, for example, by putting in a roundabout or speed bumps to slow down traffic, well, there are policy strategies that we can implement as well around reducing speed, for example, or other types of strategies. And what I do now when I talk about capacity in the space is I center equity in these conversations, I center anti-racism, and ask, well, how do we lift up policies in a way that are not going to exacerbate the racial inequities that have been so present in our society? And so as we talk about building capacity, I challenge all of us to think about, are the policies that we are looking at, are the policies that we're considering, are they actually helping to address the problem, or are there unintentional or even anticipated consequences that are actually causing more harm? There are lots of tools out there that I use in my space, that my colleagues use, things like health impact assessments or other types of racial equity impact assessments that we can use to consider how the policies we are looking at could improve health, harm health, improve equity. And I'm happy to talk more about those tools a little bit later. But certainly for me, engaging with community, engaging with policy is really critical for a well-functioning democracy. And again, it's not always easy, particularly when I think about places where it's just really hard to access government physically, transportation barriers. If you don't have a car, it's hard to get to some places, and it shouldn't be that difficult to get there. And because of that, or because of times that things are held. So for example, I was asked to testify at a hearing related to a local bill on complete streets, a local ordinance. And, you know, the hearing's like in the middle of the day. And, you know, if you're working, it is hard to say, I'm going to leave my job and go have my voice be heard in this process. And you can imagine why people feel like the process wasn't designed for them. It wasn't inclusive. And so I just lift all of those up to say, when we think about how we can support policy, again, there's a variety of ways to engage in the process. We can help to inform policy formulation or even the implementation part. I just encourage all of us to think about how we can be involved, whether it's providing data, whether it's actually translating knowledge to help engage with policymakers, whether it's going to your own elected officials and telling your stories about how decisions related to safe systems and transportation and equity affect your life, partnering with local advocacy groups that do that regularly. I'm happy to unpack some of this in our conversation, but I just wanted to, in my opening comments, just really make a strong plug for engaging in these processes. And if you're not comfortable doing that yet, I could talk about some tools and some ways that you might consider getting more comfortable and partnering with others who are comfortable in these spaces. So thanks, Kelly.
Yeah, thank you very much. So I encourage those who are with us live and might have questions from the introductions to feel free to put it in the chat. We'll keep monitoring that, but we're going to move on now and ask that the panelists describe how their work informs change in transportation systems, potentially at the community level, and/or with a focus on addressing the long-standing inequities in our transportation system. So Becky, I'll ask you to comment first, and then Keshia.
All right. Thanks, Kelly. Yeah, and thanks, Kisha. I was just thinking about what you said about kind of advocating for kind of policy change and kind of authentic community involvement in this process and making it kind of more tangible. And when Kelly asked this question, one of the things that immediately came to mind on some of kind of the tangible ways that we're working to change these transportation systems is some of the work that we're doing here in North Carolina with our Vision Zero communities and coalitions. So, and I think there's really exciting work kind of in the safe systems and Vision Zero space, and the way that a lot of coalitions really across the country are structuring this work to get kind of more diverse partners together working towards shared goals. But in North Carolina, we are fortunate that we have some support from the state to basically work as sort of a technical assistance center for communities across the state pursuing Vision Zero. And so we do a couple of things. One is, well, A, I should say we learn a ton from them. And then B, I'm learning every day of the challenges that people really face in trying to do this work kind of on the ground. But B, we try to bring what we can from public health and planning and other disciplines, you know, being at a university and sitting here with all these kind of people in different fields, we bring kind of tools that we can bear on how we can, you know, really develop collaborative goals, how we can tangibly integrate and center equity into their work. Checklists and guides that we can provide when building a coalition from the outset to help kind of really set you up for success to the best of what we know from the evidence base. And the second thing we try to do with them is to serve as sort of a conduit and a connector of information, which I think is also really, really important for this larger systems change and for policy change, right? So instead of sitting with, you know, 8 or 10 Vision Zero coalitions across the state who are doing really, really hard work that is really no one's full-time job. It's often added on to all the other responsibilities that they have. And they're trying to bring a whole bunch of partners together, trying to authentically engage in the community. And you can imagine how putting on top of that, trying to also engage, you know, with state level partners to talk about policy change, and also engage with the communities across the state to make sure you're not necessarily reinventing the wheel, but building on lessons learned. It's just quite frankly too much. And so we try to help with those second two things to the extent that we can, which is how can we more efficiently diffuse good ideas of what's happening across the state, knowing that we're all focused or seeing kind of similar barriers in this work? How can we facilitate, which is what we're planning right now, a statewide task force. So some of these policy barriers, right? So we have 10, you know, different communities or so working on these problems. How can we elevate and amplify their voices and, like you're saying, Kisha, make the policy process more kind of accessible and kind of advocate at a more combined in a more combined way, and how can we kind of learn from each other more efficiently so that we can get to that bigger change faster? And so that's just an example of something that I think is critical. I will say I've seen other states, there's pockets of other states doing this as well. It definitely does take investment from someone to really realize that this type of kind of information feedback and information sharing that I think we often take for granted is absolutely critical to trying to get this work done.
And Kisha, before you jump in, I just want to mention, so Vision Zero, I think I'm seeing many people that I know on the call, but just in case for those who join later, Vision Zero is a strategy to eliminate all traffic fatalities and severe injuries while increasing health, safety, and mobility for all. So it was an initiative first implemented in Sweden in the 1990s, and then it has come over to the US and has been expanding. So I just wanted to mention that in case there's a listener that didn't know what Vision Zero was. Okay, Kisha.
Great, thanks, Kelly, for getting us all on the same level with terminology. And I appreciate your comments, Becky. And I think what I'm going to say will sort of, I think, dovetail nicely on what you just shared. And you know, when I think about some of the work that I've done in Baltimore, I'm going to begin by saying something that may sound very obvious. When we think about how do we address these longstanding inequities, part of it is first naming them, right? Like how many times do we not talk about things that we're uncomfortable with, are naming the fact that there are communities that have been historically marginalized and areas that have been disinvested in, where we are seeing more significant inequities. Talking about transportation as a determinant of health, which I do as a public health person. And I have had the privilege of being invited to spaces where I might be the only public health person who can bring that perspective. So I've sat on our Baltimore City's a while ago, a pedestrian safety task force, where we're talking about why, yes, walking is critical, and what does it mean for public health? How do we ensure that people feel safe when they're walking, safe from traffic, safe from crime? How do we feel that spaces, how do we ensure that people feel that they are in spaces that are also inclusive, right? I know a prior panel, there was some that Charles Brown was on, talked about arrested mobility, and that's critical. I think about promoting walking and biking for Black and brown people. And what does that mean when people feel like they can't safely move around because they are likely to have some engagement with law enforcement or with somebody else who feels like that space isn't for them? I think these are real barriers and critical for public health that we have to discuss and name. Or I think about in Baltimore, I had the privilege of being on our mayor's bicycle advisory commission for several years, and again would bring up these important issues around equity and how do we then emphasize solutions and what we can do. One example that I just want to share briefly, I mentioned health impact assessments earlier, and this is a tool that I use a lot in my work, and also it's a way to bring in and partner with community members to help identify the potential health impacts, both positive and negative, the potential equity impacts, both positive and negatives of proposals. So imagine a transportation proposal that's related to a policy. Well, we can do this analysis up front that involves strong community engagement, involves various sectors being engaged in the process, using some of the tools and strategies that Becky talked about, to then name how health could be harmed or improved if this policy moves forward. And so I want to just mention that there are lots of terrific tools out there that help us to name these inequities, help us to name the importance of transportation for public health. And I think the final thing I'll just say here is, the COVID-19 pandemic has, I think, really highlighted for people in a new way what many of us already knew, which was how significant inequities are in this country and how they lead to disproportionate deaths and illness in certain communities. And I think transportation has been, I see people talking about transportation in a way where I didn't see them talking about it before the pandemic, and how transportation connects to health, whether it's access to getting to the hospital, getting to vaccines, about mobility issues. I mean, just things in a new way. And I just want to remind us, all of us, just about the importance of naming, again, these inequities as we're thinking about the pandemic, as we're thinking about transportation systems broadly. So I'll just stop there and offer that for this conversation. Thank you.
Kisha, I was interested, you mentioned health impact assessment, and then also earlier the racial impact assessment. Can you just give us a little insight into what that is?
Yeah, thanks, Kelly. So as you might imagine, right, there's so many impact assessments around the world. And so the health impact assessment is one that people may be more familiar with, and has some historical ties to environmental impact assessments, environmental impact statements. But basically, it's this a process by which we use best available data, stakeholder engagement, community engagement to identify the potential health impacts of a proposed policy, project, or program in terms of how it could affect health. So we do that up front in order to inform how that proposal might actually play out when the decision is made. In recent years, there has been some energy around racial equity impact assessment. So a similar tool that actually has a lot of deep roots in the criminal justice system, where policies or programs or projects are looked at for its impacts on racial equity. And so I've been involved in work where we have actually done a rapid health impact assessment, so a really short one for an active bill, and a group has done a racial equity impact assessment on that same bill. You can imagine the two of those tools, being combined to present a really comprehensive picture of how a proposed policy could impact racial equity and impact health equity. So I just mentioned that to say there's lots of tools out there that are used to, again, to highlight how a proposal could impact health or racial equity. And the goal is to try to inform how we then approach it before that decision is made.
Yeah, excellent. Thank you. That's very helpful. So Steve, I'm going to ask you to comment, maybe more broadly, even beyond transportation.
Sure. Yeah, I mean, I wanted to pick up on the extent to which these are sort of good team, what we're talking about is sort of good team construction and good team leadership. We use I hesitate to call it a tool, a framework called mutual learning teams. This is in a book by a guy named Roger Schwarz. You can look him up. He's a UNC faculty as well. And what Roger says is that mutual learning teams start from everybody has a perspective and they need to share it. We need to get all the perspectives on the table, and we need to expect there'll be some conflict. There'll be some disagreement. People will have different perspectives on whatever it is that we're asking about them. And we need to have the capacity to manage that. That's the leadership role. So yeah, you need to, that's sort of this whole, I need to have some ability to connect authentically with lots of different groups, because I absolutely need their perspectives on the tables to do the design work that's required. And knowing that people are going to come at it from different perspectives, I need to have in myself as a facilitator and in my group some heightened ability to manage conversations where I know for a fact things are going to come out that look disparate or look like they might be in conflict, and we need to have the skill set to work that through, and not have anybody get defensive or decide they want to grab the wheel. That takes some work. I mean, that's all sort of, it's very much go slow to go fast. I mean, you need to build the relationship. You need to do some work on building that team in that way and setting up your assumptions and your culture for your group so that these things can happen. One of the things I was thinking about, Kisha, when you were talking, is that mutual learning teams are really good at defining terms. What I mean is, I mean this when I say equity. We're talking about these specific things, and we build the capacity to say, can you give me an example? Because I'm not sure I know what you mean. Like, give me an example. And is this what you mean? We use a lot of different things to help people get in that learning space, but that's essentially the job. One of the things we've used to get teams started is from a book by Peter Block. Do you know this book, Kisha? Community, the Structure of Belonging. To summarize it, you go all around your team and you make sure everybody has a chance to say, this is why I think this is great. These are my aspirations for our group. But it also encourages everybody to say, these are my boundaries. And these are my doubts about this. We need to make it okay. I mean, if it's authentic, it means everybody's okay with saying, you know what? These are my aspirations, but I also know we've been here before. We've done this before. I'm afraid it's going to go like it went the last 3 times. Or I think we're all on board, but there's somebody missing, and I don't think we can do it without that person. Or I'm not sure I have enough time and energy to do what's required. We need people to have the chance to say, these are the edges for me, and these are my worries. So I need you to know that going in.
Yeah, I just want to jump and say, Peter, Peter Block's book, Steve, is a great one. I love that you mentioned that. And I think what's so important for that, or critical for that process to work, is making people feel like they are, that you acknowledge the risk they're taking and sharing, and that it is okay to be in that space where they can share and be their authentic self. So I really appreciate you lifting up that resource for other people to use as a book or a guide when they're engaging with various constituents or community members or policymakers, whoever it is.
Yeah, I hope that's answering Ellen Zaviska's question. I think it might be.
Yeah, I was going to bring her question up because it's so relevant to what you were just saying. Yeah, are there other strategies to help people open up about their perspectives? Yeah.
I mean, if you do mutual learning teams well, if you use Peter Block's book, you get trust as an output of staying in that growth mindset, of staying in that learning space that you can reinvest, because you're going to be at this for a long time. You're doing some really big stuff. So, do the adaptive work to uncover the capacity, get the people plugged in, convince yourselves and convince your group that this is the kind of group where we can share perspectives and it's okay. And we're gonna find our way forward by co-designing. Yeah, you got to get the perspectives out.
Yeah, and Kelly, can I just add one more comment about this in relation to, I think, Ellen's question, and there made me also think about, and follow up to Steve's comment as well, that acknowledging the mistrust that may exist from the beginning, and really knowing that there are people that have been in situations that have felt like, I've done this 5 times and it's never worked. Why is this time going to be different? Yeah. And acknowledging the amount of time it may take to build that trust, right? And I think probably Becky has good examples too, of like bringing people together who aren't used to working with each other and are a little suspicious of what are the real intentions here? How is this working? And I found in community, we have to really make time for that. And I feel like sometimes people try to rush through those steps. And I just wanted to name the importance of acknowledging that time.
Mm-hmm.
Yeah, Steve, I'm trying to remember. I feel like there's a series of ground rules that we'll start with, at coalition meetings or in meetings where we feel like you're saying, Keshia and Steve, where there could be the potential for conflict, and there often is. And I can't remember if it's Roger Schwartz or others, but it has this kind of a series of ground rules about, I have information and so do you, and we might not. Is that Roger Schwartz? Yeah,
that's okay. Roger.
Yeah. They're beautiful. Yes, we use them all the time. Yeah.
Yes, really nice.
Thank you. And both of those resources are now in the chat for people to clarify. Okay, I'm going to move on to the next question, where we describe some success stories. It may be around what we were just talking about and people opening up, but you may also have other stories on addressing part of the inequalities that or that embed systems and interdisciplinary tools into transportation decisions. So I'll open it to either Becky or Keshia to get started on that.
I have another tool kind of related to a success story that I'll share, because I know, sometimes with the systems work, it can come off as very abstract and amorphous. And I think the ability to give these frameworks, like I'm writing them all down, the racial equity assessment, the health impact assessments, the community book, and Roger Schwartz's work. Another one that we use a lot, and I'll put it in the chat, that some of you may be familiar with if you have been hearing some of the stuff coming out of the Collaborative Sciences Center for Road Safety, is this 5Rs tool. And I know Steve is quite familiar with this tool or kind of framework as well. And this is actually a systems tool. Well, it's more of a framework. I don't want to make it sound too much fancier than it is. That came out of work from USAID, so U.S. Agency for International Development. And they started realizing, right, they're investing billions and billions of dollars a year in a variety of countries, dealing with huge issues, right, related to poverty, socioeconomic development, disaster relief. And they started realizing that if they wanted to see lasting change in these big systems problems, they really needed to strengthen the local systems that were producing the results that they saw. And so they developed this framework, real simple framework. It's 5 R's, and I'll kind of briefly tell you what those are, that they use in the project design stage, implementation stage, evaluation, monitoring stage of kind of all of their projects now, and they've really invested in and taken to heart a lot of this kind of systems work. And so what it is it's a tool that can often be used in coalition meetings or meetings with these different groups of stakeholders. So it's results, rules, roles, relationships, and resources. I think I got them all. And so what you do is it provides a framework for viewing different aspects of the system. And we've used it specifically to have hard discussions about how inequities permeate all these different facets of the system and why they're leading to the inequitable outcomes that we see. So first, you generally start off defining the results. So you have a really real discussion about what you're trying to achieve as a group. What would meaningful change really, really look like, especially related to inequity, and how you can make things more equitable. Then you'll move on to defining the roles in the system. So who is both affected and affecting those outcomes that we care about, right? And that leads to really important discussions about power dynamics and who has been allowed to participate in these systems and who hasn't, and who we've been systematically, excluding from a lot of these decisions and kind of creating change. Then it'll move into rules, and you can imagine discussions about rules and policies and norms and laws, and the discussions that you can have there related to equity. Resources, similarly, what resources are and are not available to different people in the system, and how can we design action that's mindful of those resources and creating more equity in the resources that are available to individuals. And then finally, it ends with a discussion about relationships. So what relationships have been harmful in our systems? What relationships maybe do not exist or missing in our systems that we need to build up and foster and support? Again, all if we are going to see that outcome that we've agreed on at the very beginning that we really, really want to see for change. So it's a really, really useful tool. It can be done in an hour or two, but I've seen it time and time again. We use it with our classes at the university. We've used it with transportation professionals to have these discussions. And it provides, again, some structure to discussing kind of these huge, big, complex issues and can really provide some rich insights. So that's one of my favorites that I'll leave with you.
Yeah, I appreciate that, Becky. You introduced me to the tool, and I do think it helps provide a deeper conversation because it breaks it up, this big question. So thank you for that.
Yeah, Becky, I love that. I'm unfamiliar with the tool, but I have bookmarked the link, so I look forward to checking it out. Thank you. And speaking of resources, I just dropped in the chat a resource just about health impact assessments. There's I've been a consultant for about a decade with a group called the Health Impact Project, which is a collaboration of the Robert Wood Johnson Foundation and Pew Charitable Trust, who was founded many years ago to help support the growth of health impact assessments and broader tools to support consideration of health in various sectors and health in all policies. And this link here is actually to a searchable toolkit where actually you can find HIAs that have been done on transportation proposals specifically. So if you're interested, there's over 400 different HIAs in there, many on planning and transportation and housing and different areas of public health different non-public health areas, different sectors and how they connect to health. But I encourage you to take a look at that link, and you can look for HIAs that have also been done in your state. There's a map and you can click on ones that have been done in your city, in your region, in your state. And the reason why I put that up is that when I think about this question, Kelly, with some success stories, several examples come to mind for me of HIAs where community members, as you know, may have has come from a place where they were never at the table, right? That there's this history of being excluded. Becky just talked about power, and they were not at the table. They were on the margins. And through examples where a tool like an HIA was used, the process was used, members of the community were involved in a number of the steps, from defining the problem to talking about how a proposed roadway was going to impact the community, even being involved in collecting the data. I was involved in an HIA in Baltimore that was affecting some young people, and we trained up the young people to help us collect data, so helping people also to understand, why it's important to define the problem, why we need evidence to help inform decisions and strategies. and certainly lots of examples where members of the community helped us think differently about a problem, right? The evidence might only point to sort of one way of thinking about it, or narrowly describe something, and who knows the community best than people in the community, where they can say, no, Keshia, that's not what we're seeing. This is what we're seeing on the ground. And so being able to bring those perspectives from a research perspective, we think about it sort of ground truthing, some of the things that we're hearing, and then also involving members of the community in the development of recommendations based on the evidence. And so the link that I shared has many, many examples where you can see how members of the community were engaged in processes to lift up the potential health and equity impacts on residents before a decision was made, where then they have the data where they can go to a hearing, a proposed hearing on its proposal, and actually share this evidence. You'll find on that website too that I shared, if you search around a little bit, there's a couple of videos that highlight some really great HIAs that have involved community and that have impacted decisions that have been made, and really impactful stories where you see the power of data, the power of evidence and numbers for the policymakers making the decision, and the power of the community that were involved in collecting the data.
Thank you for highlighting that, Kisha. I didn't realize you were involved. I've definitely accessed that database before, and I'll go back and look for those videos. So Steve, I'm gonna turn it to you now with this question.
Yeah, Becky, while you and Keshia were talking, I was thinking, ooh, this is just like really good design thinking, right? On a big scale. Design thinking, the first thing you do is you try to understand who are the people who are going to be affected by the thing that we might do. And even before you start designing the thing, in design thinking, you just think about your customer. Who are they? What are they seeing? What's their job they're trying to do? What's the job a specific person is trying to do? and what are their pain points, and what are the opportunities they're trying to maximize? And then how is what we're going to do help them? And then way before you roll it out, you're going to draw it up on a sheet of paper and show it to them and say, what would happen if we did this? What would happen if we did that? Would that meet your need? Would that mess you up? Here's what we're intending to do. But before we do it, what's your perspective? What do you see? That's what you guys are designers. That's how you do it. It's a different notion maybe of who you're going to ask for their perspective. We all get stuck in you go to your boss and just tell me what I need to do and I'll do it. That's like the technical thing you were talking about, Becky. The other thing I was thinking, Keshia, when you were talking, was about a team from Omaha that's in my Emerging Leaders program. They reimagined their role as a public health agency, and they said, what we want to be is the chamber of health. It took them a long time to get to that, but they decided that's what we want to articulate as our role. We want to be the chamber of health. People know what that means, especially in Omaha, Nebraska. Once they had that, they used it to frame up. They started with a housing, not a transportation, Becky, but it's similar to what you were saying. They brought together people who had a perspective on the housing situation in Omaha from across the community. Renters, homeless people who work with the homeless, the business community, lots of different planners. And they spent, I think, at least 5 full days. I think they did it in a week. They did a causal loop diagram for what's the system that we have in Omaha for how people get housing. Because they had that frame, they were able to get a lot of perspectives they might have had trouble getting otherwise. And what they came out with was a really good articulation of, here's how it's working. Here's why so this is a system map that shows how a lot of different variables connect and influence each other. It's very non-linear. And what it does is it explains a series of important outcomes that they'd seen in Omaha over the last 10 or 20 years. And it articulated, where do we want to see these variables go in the future? So we want the number of people without homes to go down. We want the number of people in affordable housing to go up. And they had lots of other outcomes that they were interested in as well. And they mapped it out and felt pretty good that they had all the perspectives on that map. So that's a causal loop diagram is sort of maybe a next step past the 5 R's, Becky, for a way to do that. It starts with, what's the change we most want to see? And then you build backwards to understand where are all the variables that are creating the output we're getting now on variables of concern, and that we would want to figure out how to tweak in order to get a different outcome.
Yeah, thank you for mentioning that tool. And I love the idea of being a chamber of health. Was that an end result of doing the causal loop diagram?
No, that was pre-work they did to think about, wait, what is our role?
Oh, okay.
Who do we want to be in Omaha? They said, we want to be the place where a bunch of leaders and stakeholders come together and make good decisions. Like the chamber does.
Right.
For economics. We want to be that for health.
Yeah, that's neat. Kisha just popped in the chat the 2 videos, which I really appreciate. One on a housing project in Oregon and one on a skate park in California. So thank you so much. So I am just going to pause and encourage people that are listening live, if they do have questions, feel free to include those in the chat. And I'm also going to, before we move on, just ask the panelists if there are any other success stories, whether in or outside of transportation, that they wanted to discuss before we move on.
Kelly, this isn't a success story, but Steve's story just really brought something to light to me that I really wanted to share, which is, it sounds like the kind of vision that the group was talking about, sort of thinking of this new health entity. I think what's so important about that is the freedom to think about how the world could and should be. Right? Like I talk with a friend of mine oftentimes about liberatory thinking, like we really freeing our mind to say, what world should we live in? And I ask my students that in class, if we think about transportation system, what should the transportation system look like? If you ask kids, what should school look like? They're not going to talk about safety resource or officers or metal detectors. They talk about a place where it's fun to learn, where I have food and my belly's full and I have fun with my friends and I'm learning. Like, so, I challenge people to think about how could our world be? And let's just free our minds and imagine that. And then think about what are the tools that can help us get there? Tools like policy, tools like systems thinking. So your comment just brought that to mind for me.
Yeah. Amen. All the way.
Yeah, I have
There's sort of an appreciative inquiry. Sorry, Kelly. There's an appreciative inquiry assumption built into Vision Zero. In appreciative inquiry, the first thing you do is frame your goal as a positive thing you're going after, not a half measure, but where are we driving to? And then the first thing you do is you make little groups and you ask people, what's going great now, and what do we most want to see? Like, name your big dream. I mean, let's understand what the really big aspirations are before we decide what the practicalities are. And let's do our design work aiming toward those big aspirations and those big ideas about what we we could be together.
Yeah, and I think it aligns with the name Vision Zero, that there's a vision, it's part of what it is.
Mhm. Absolutely.
Steve,
Yeah, it
while
gets
you-
messy in the design phase, because
Yeah, right.
you can't do everything all at once. You have to stage it, and you have to make some decisions probably at some point about how many resources you have. But starting from dreams and what do we already have in terms of capacity is just, it puts things in a different light. It makes people much more excited and energized and plugged in, and potentially feel more like they belong to that effort because it's linked to their dreams.
Yeah, and really lifts up assets, right? Like, why do we need to start from a deficits perspective? Let's start with our strengths and say, where do we build from, right? You mentioned that earlier. I think you both did, in terms of seeing where communities are. And, as you talk about building capacity, well, where are people starting from? There's so much strength there already, right? And so how do let's lean into that as we reimagine systems and the role of policy and community engagement to help to get to where we imagine that vision of what transportation should look like.
Yeah.
Yeah, I like the way Steve said that you have leaders in your community, in your workplace already, but bringing that out, that it could be a hidden positive that you're not even aware of.
Yeah.
Steve, I think you mentioned that there might be some tools, and we've talked a bit about that. I just wondered if there was anything else on that before we move on about, bringing people into the process before they get there.
Yeah, I mean, appreciative inquiry, I think, is the first thing that pops to mind, Kelly.
Okay.
It's Cooper Ryder. I can't remember his first name right at the moment, but there's a ton of resources on this appreciative inquiry approach, and I think it's what I think it would do in sort of transportation space is provide a really useful frame for you to get to the design conversation you want to have. That's positive, open, creates belonging and excitement about the big goals, but gets you pretty quickly to some of the specific sort of system tools and design tools, some of which we've mentioned here, and many of which I'm sure this audience already has in their tool belt. It frames that stuff in a nice way.
Okay, thank you. So I'm going to transition to now ask what's holding us back. So why don't we have a stronger focus on systems and a more multidisciplinary team or approach to transportation planning decision making? Why do we have transportation developers building roads that don't support walking and bicycling and that create food deserts? So what needs to change? And I'll ask Becky to start.
This is tough. I mean, there's a lot. There's probably a lot that needs to change. And I think we've been talking a lot about this kind of collaboration work at so many different levels. I would think hopefully most people are bought into it, right? Is it absolutely worth it? Kind of, does it pay back dividends? All of that? Yes. Is it really, really hard to do? Yes. So, obviously we're all constrained by the fires of the day. A lot of our systems aren't set up to support this type of work. I think the extent to which we can get kind of more investment and support in this, again, that's hard to do. Some other panels I know did kind of touch on this a little bit, talking about kind of more investment in this and kind of advocating for this at kind of higher funding levels to do some of this kind of hard collaboration work, bringing together groups of stakeholders, creating backbone organizations that can act as those kind of connectors. There are pockets certainly being done. I think it is exciting to see what's being done in, public health has done it for a while, and a variety of different types of coalition-based efforts. And there's been a lot of great examples in that space, from tobacco, violence, polio, and some infectious diseases. And I think transportation is starting to do really, really great work in this space through Vision Zero and sort of other efforts. But yeah, it's longer, it's bigger, it's tougher work that requires that kind of investment. So I'm hopeful, but I also know it's hard work, and it's not the norm right now that it's invested in.
Yeah. Kisha, I'll let you go next.
Yeah, thanks, Kelly. And I ditto to everything Becky just said. And certainly I'm optimistic because we have seen some successes, right? There's some good examples of where we see strong multi-sector collaboration, where we see transportation departments and planning departments and public health working together. We see people raising these important questions. I will just add that I know I get really frustrated when I'm in a room with people and they say, well, we've never done it that way, or that won't work here. And why not? Why won't it work here? You know, and it gets back to some of that visionary thinking, liberatory thinking I mentioned earlier. And I was a scholar who I follow, whose work I follow, Ruha Benjamin, once said, you know, if we're too afraid to imagine, someone else will imagine for us. So when I think about that, it's why not imagine a system that brings together everybody, a system that's not siloed in terms of funding or in terms of other things. Because if not, it's so easy to just keep doing it the way that we've been doing it before, which hasn't been working for everybody. And so I just add that to what Becky shared, and say I am optimistic. I see movement, I see things changing a bit, and I'm hopeful that we'll see even greater change in more communities.
I think this is a great question for this group. What makes you think this isn't going to work? Here comes Johnny with his. A couple things come to mind for me. One is short-term thinking is going to lead you into doing what you've always done. We spent a lot of time with our emerging leaders, and we spent a lot of time in my maternal and child health program, in fact, too, working with people and asking them, how long do you have? This is generational change, isn't it? I mean, what you need to get done in the next year or the next 2 or 3 years is a lot of adaptive work to get ready for the transformation. It's not, you don't have to jam the transformation into 3 years. So what if you gave yourself 20? I mean, Atlanta has a coalition of hospitals, and they were doing these community health assessments and trying to build little 3-year action plans. And I finally said, wait a minute, we don't need to kill ourselves to eliminate racism in 3 years. No, we're not going to do that. What if we had 20 years to do these big things that we want to do? Wouldn't that feel freeing? Wouldn't that enable us to go slow to go fast, build some relationships, do some piloting, and do some really ground level, do some of the pipeline work that you talked about, Becky? And if you have 20 years, let's get busy now on building the pipeline. And that's not going to pay off in 3. It is going to pay off in 20. Absolutely is going to pay off in 20. So the bowing to the short-term thinking and the urgency, I think, can sometimes get us off track. I think the other thing we do is we over-interpret our own boundaries. We put boundaries on ourselves that we kind of invented. I'm working with a group. I'm working with a group that's a state agency that figured out within the first week of working with us on the Workforce Development Center that what they thought were sort of legislatively required rules were just policies that they'd put into place. They were really just procedures. They were eminently changeable. Somebody just thought, well, this is how we're going to divide up the resources, but that's not in the legislation. That's not in the rules for how the money gets spent. We put those on ourselves 20 years ago, and then we forgot that that's who did it. So are there some of those? Are there some places where we're making up rules for ourselves? We're making up our own box.
So we've had two comments that I want to mention for those that are just listening or who listen later and don't view the video. So Kristen wrote that the panelists from a prior session encourage people in a position to write or scope proposals or projects to build in time, to build coalitions, honor past experiences, and to build in the funding to pay people for their time and for sharing their community knowledge. Yeah, because often these people are asked over and over again for those that are willing to volunteer. And then I just want to read Johnny Morell posted a comment. I hear so much discussion along the lines of if only XYZ can be made to happen, we would get the coordination we need. But I'm in favor of that. But I also think those planners are being rational and having narrow perspectives. That's adaptive behavior in the ecology in which they are spending taxpayer money and their own political capital.
Yeah. Absolutely right. I'm sure you see that, Kesha. I mean, that's sort of what the HIA process is trying to help. It's like before we get too far down the road, let's make a prototype, run it past the appropriate people, and not just zoom past that step. So in design thinking, it's do the prototype first. And stage things, pilot things, do little steps that are going to get you toward the transformation.
Yeah, I appreciate that comment, Stephen. Yeah, and certainly HIA is trying to fix that problem sometimes, right? That we propose something that we may think is the prototype, or even we don't even think about that at all, and we're trying to systematically think through what could happen if this moves forward. And I think that's sort of the power in that tool. It's, if this proposed policy gets passed, turns into a law, how might society be in terms of our health? How might it be in terms of equity? And I think there's still a lot of people who don't even know what HIA is. Like the stuff I'm talking about, they're like, what is that thing? What is that tool? Policymakers still don't know about it. I think there's been a lot of growth in the US over the last 20 years that HIA's practice has sort of been here, but there's still a lot of people who are not familiar with these tools. I'm sure these other tools we're mentioning too, there are people on this call today who have never heard of some of these tools. So I'm glad we're having this conversation, and it makes me just wonder who else do we need to be talking to make sure that people are aware of these tools, of how they can be used to help to meet the goals we have for transportation systems and other areas of work.
Mm-hmm.
Yeah, I'll just say, I know this is, I was just thinking of one other kind of story that had come up with an interaction I had a couple of weeks ago, and kind of getting at this tension of silos and getting the work done that we need to get done, while also kind of establishing this foundation and doing more of this kind of interdisciplinary connection, right? It's a tension in kind of all of our day-to-day work. But we had this project that we were doing. This is outside of kind of the transportation space. A few months ago, we were working with kind of teams across the country who were focused on suicide prevention and other kind of violent outcome prevention work. And we were using some systems tool with them to kind of see the larger systems surrounding these outcomes. And they were taking, I don't know if people are familiar with, I don't want to use too much jargon, but a shared risk and protective factors approach to their work. And so that idea is that so many of our injury outcomes have overlapping, right, root contributing kind of factors. And if we can understand some of these root causes and factors, we can help prevent many of these kind of downstream problems that we see. So these root factors are like access to mental health and substance abuse services, access to safe and affordable transportation, sort of any number of things. And so one of these groups we were working with was based out in Oregon, and we were using a tool with them where it's called this goal and action alignment map. So basically what it does is you have your organization that sits here, and you have objectives that you are working hard on every day to achieve. You also have pain points and challenges that you're faced with every day. And we ask people to kind of prioritize those. And then we ask them to go to their potential partners and listen to them, right? What are their objectives? What are they really honed in on every day? What's really getting in their way? And then what we often do is for this group, we were focused on those shared underlying factors. And we asked them to start telling stories to make connections between how what their organization was trying to achieve every day might connect to some of these shared factors. And so what you end up seeing is this generally this really nice thing kind of comes up, which is that we all think we're focused on very different goals, but when it comes down to it in kind of maybe less obvious ways, we're all connected to a lot of the same factors that are driving these problems, and we can actually identify some win-wins by acting on some of those factors. And so this team in Oregon had this kind of wonderful story from doing this. They had done their mapping work. They had gone and they talked to some legislators and policymakers in their area. And they had a new county commissioner that had come in, and they contacted him and said, hey, we want to talk to you about our suicide prevention work. And his response was, yeah, I don't do that. That's not one of my priorities. I'm sure that's important, but that's just not like what I'm focused on right now. And they said, okay, yeah, that's no problem. Can we just come listen and learn from you about what your priorities are and what you're really trying to advance right now? And he was like, sure, yeah, like, come on, I'll tell you what I'm working on. And they went and talked to him, and he talked about how he was really focused on improving access to outdoors, building community through kind of shared culture and history, more public events. And they were sitting there listening and started putting some of the pieces together on how what they were trying to do kind of actually did relate to some of his goals. And so then they started having this really great conversation about kind of mental health, building connections in the community, individuals kind of caring for each other, how that can be done through effective outdoor spaces, how that can be done in their work, and how that relates to suicide prevention. And so from that just conversation where they really just went to listen to what he was really focused on, and then he started learning like, okay, well, there might be some things in the background here that are connected. He called them 2 weeks later and was like, okay, you know how I told you I'm really focused on outdoors and improving access to outdoors? I'm starting some projects and we're going to invest a ton of money in the community and improving public parks. And he was like, and I was thinking, we have some shelters in these areas where maybe some of your mental health providers could come and do group counseling and some of these activities that you're wanting to do to build your suicide prevention work. Would that help you achieve your goal too? And they were like, yeah, absolutely. So it was just this beautiful conversation of people talking about what they thought they were really focused on. And then we're able to identify these connections and really these win-wins for both of them. And I thought about that, and I immediately thought about, oh my gosh, transportation is connected to everything, right? Clearly there's more of these kind of stories out there. So, so yes, I hear you on the fact that we need to get kind of our silo, like our work done day to day, but also kind of having these conversations across others can sometimes really bring up some beautiful connections.
Yeah, that was a beautiful example, Becky. What was the tool that started this whole process? Yeah,
so it's a tool that we're actually going to be using with some Safe Routes to School coordinators in North Carolina soon, and we're kind of writing it up. There's not much out there on it right now. It's called Goal and Action Alignment Mapping. Steve, you may have used it some, not yet. So, but we can make that actually. We can make that more. It's actually through a project that's funded from the Collaborative Sciences Center for Road Safety. So we'll be posting it on the website too, the results of it and the tool itself. So we will send that out.
Okay, thank you.
Mm-hmm. I just wanted to jump in and say too, Becky's comment is such a great example of how do you do really good policy engagement or engagement with the policymaker, right? It's understanding. I love that they went to listen and they started to hear those connections. When I go visit a new legislator, I do that homework in advance to say, okay, this person, we don't really have a lot in common. We are even on different sides of the aisle, whatever it is. But where are those connections between what I care about and what this person cares about and they're championing for? And I love that in your example, the members of the community were able to connect their work and interest in suicide prevention to this person's platform and interest, right, in a way that they didn't think there was connections up front. And so I like to encourage people to think about those connections when we're going on a visit where we are, so we're aware of some ways that we can connect our work to the broader platform. Because as you said, transportation connects with everything.
Mm-hmm.
So what do you guys think about what Ellen says, that people are loath to collaborate outside their organization because it's hard to get other people outside your organization to then do what they said they would do. And you don't want to be dependent on them. I think that's an interesting take on it. I think Becky, your example is I'm not asking you to do anything in particular right now, but I do want to listen and see if I can make a loose tie. It might be helpful.
I think that's it, right? So, I mean, in an ideal world, and I know if people are familiar with the collective impact models and different things like this, right? There's this premise that you have to have this strong backbone kind of coordination that is going to keep that going. But yeah, I think that's the key, Ellen, right? I think it is kind of listening and identifying ways that it doesn't feel like another add-on, right? Like no one needs another add-on and another task to their job. But are there ways, and we won't with everyone, right? Like that's too pie in the sky. Everyone we won't be able to identify these win-wins with that is something that I want to be doing anyways because it relates to my mission. But I do think there are more opportunities out there than we often see. So yeah.
I mean, in causal loop diagramming, a lot of times the easiest and potentially earliest, most effective intervention is just to send some information from one part of the system to another part of the system so that they know we're going to change, we're doing something to change this output of this little variable, and you're going to want to know that that's coming. So it's a little like kids playing soccer. At the beginning, it's just a cluster of kids around the ball, right? Everybody thinks their job is kick the ball, and everybody goes to the ball and tries to kick it. And later on, we figure out, oh no, we have different roles on the team. So, maybe, so that's like a silo, right? My siloed job is I stay on the right-hand side, and I'm in charge of running ahead. I don't need to do everybody else's role. I need to know what they're doing and be ready for them and be paying attention to them so I can take the pass. And maybe that doesn't take quite as much coordination as we think. Like if I stay in my lane and you do your thing, maybe that's easier than we think.
Mm-hmm. Yeah. Becky, were you going to say something? Or just, no. I was just going to say, Steve, your comment and Ellen's comment made me think about a conversation I once had with a colleague, a transportation colleague, and we were talking about challenges to cross-sector, multi-sector collaboration. And he said, I would do more of collaboration if my job, my performance review had a metric that rated me on how well I was at collaborating. And I thought, yes. Who does that? Like, is that what you're saying? If that was built in your job and that was a performance metric, you would be more likely to do it. It was just, it's something that sounds so basic, but the fact is I don't see that happening very often, right? Where like it's built into the performance metrics, and maybe there are some people on the call that can say, yes, it's part of my job and I get scored on that. I get bonuses on that. That's but it was so interesting to hear. He's like, there's no incentive. Like I want to do it because I care about it, but there's no incentive in my job to support me doing this work.
That's the very definition of I have created a new role for myself. I created a new role, and so now there's new metrics.
Well, we have just a few minutes left, and so I'm going to transition to our last overarching question to conclude the session. And what I wanted to do was go around one more time and ask the panelists for a couple of key takeaways, resources, or aha moments that you've had over the last, hour and 20 minutes. I will start with Becky. She has her mic off.
Yeah, I mean, I've been furiously writing down all of these tools and have learned a lot. I love all these kind of tangible pieces to take back and experiment with. So yeah, but in terms of, and I might put one more in there as a shameless plug for the Collaborative Sciences Center for Road Safety. We do have a systems page. Let me make sure I do this to everyone this time and not just panelists. A systems page that kind of goes through some of the different tools, breaks down some of the systems thinking kind of terminology and work. And so hopefully that's helpful for some. And I think we'll be posting more up there more soon. But my other main takeaway from this is just kind of our job and needing to kind of better advocate for this work, for these changes in the structure, like others have been saying in the chat, in how our positions are defined such that, right, it doesn't discourage this type of work, which it very much does right now, right? So like we were saying, it's not in our job responsibilities. So how can we advocate for our employers internally to change this, funders externally to invest in some of this work? Again, pockets are, and I think the extent to which we can continue to elevate the stories and what comes out of this kind of larger systems kind of communication work, hopefully others will continue to invest in it. So those are the main takeaways I have.
Yeah, thank you, Becky. I'll turn it to Kisha.
Yeah, thanks, Kelly. Yeah, a couple of comments, and I just want to lift up, I saw Robin's comment in the chat about no one mentioned law enforcement as a partner. I briefly mentioned law enforcement when I talked about arrest and mobility, but I didn't unpack it more. But absolutely, law enforcement is a partner here. And actually, I'm also going to add one more resource to the chat with colleagues from a variety of organizations. One of the centers I'm affiliated with, which is the Johns Hopkins Center for Injury Research and Policy, we released earlier this year the recommendations of the Safe Systems Consortium. And there's a number of policy recommendations in there for things that are, we think is important as safe systems moves forward. And, you know, partnerships with law enforcement, thinking about enforcement in the role of safe systems broadly and equity is highlighted in that document. And so again, didn't unpack all of that today, but thank you for lifting up the critical role of law enforcement and thinking about a system, how we move forward in a transportation system that doesn't center on enforcement like safe systems functions elsewhere outside of the US in particular, and what does that look like? And so certainly I'm in conversations with people about that, and I hope that this resource is something that you'll find useful. And I would just say my final takeaway is what a great conversation. I have loved being in this space with Steve and Becky, and thank you, Kelly, for moderating, just to unpack these issues and to really talk about the importance of engaging with community about things like appreciative inquiry. And I love the tool that Becky shared from USAID that I'm eager to take a look at later. So thank you.
Yeah, and thank you, Kisha. You said, why not imagine a system that brings everyone to the table to create a transportation system that's safe and supports all users? So I think that's a positive message. And Steve, I'm going to turn it over to you for one minute.
Yeah, I think I would say to this group, you are leaders, you have a leadership role. And it's to uncover the perspectives on your group, make it a safe place, call on people and use your own voice. You're called upon to say, this is what I see, this is why. What do you all think?
And Steve, the comment that you said, go slow to go fast, has really stuck with me. I appreciate that. So I want to thank you all three of you, so much for your time and contribution to this conversation. I also want to thank those who joined us live and who added questions and comments to the chat for your contribution to this conversation. And I will turn it back over to Kristen now.
Hi, everyone. I actually don't have any concluding comments. I just wanted to make sure and share the information that's on the screen. It was a wonderful discussion today. Just want to echo Kelly in thanking the panelists and Kelly for moderating as well. Just a few, I put the links in the chat because I know your screens are not clickable. But if you want to access recordings from the previous sessions or this one, I'm sure there's a lot to chew on, and it will be worth going back and listening again. We'll have that posted early next week. And then the Highway Safety Research Center is helping host the North Carolina DOT Research and Innovation Summit. And one of the plenaries will feature some of the panelists and moderators from this series. So that's a free virtual event. So even if you're not in North Carolina, some of the research and innovation topics will be broadly applicable. So thank you again. And I will go ahead and end the recording today. Are you guys good? Okay. Thank you, everyone.
Great. Thanks all.
Thank you. Thanks, everyone.